Good afternoon and welcome to AM 720 KDWN and today's show. So now you know, we'll be talking with Tina Drago today, First Person Care Clinics. And Tina, welcome.
Hello, how are you today?
I am doing well, and yourself?
Excellent.
It's always a beautiful day here in Las Vegas. Tina, First Person Care Clinics, what's it all about?
Well, it started out as an idea. I consulted with the governor, and I was helping medical practices be sustainable and financially feasible during this economic roller coaster that we had the last few years. And one thing I kept coming across, and that was that we needed primary care providers. And we needed high quality primary care providers. And my personal feeling is that the more eyes that look at a patient and collaborate, the higher quality care the patient's going to get. So I immediately went to a clinic atmosphere. I like the fact that the doctors will collaborate in the hallways. They'll talk about cases. They look at a patient as somebody that they want to get better always.
They share information?
Share it all day long.
Wow.
Yes.
I like that.
It's wonderful because now the patient has people with different backgrounds and different expertise actually looking at what can be done to help them be the best they can be.
Right. That's old school.
It is. You know what?
Really?
It's the best. That Mayo Clinic design, that Wisconsin Medical School design, that multiple discipline design.
This is truly a hands-on clinic.
Very much so.
Yeah. With First Person Care Clinics, what type of services are you offering?
The basics, primary care.
Okay.
Pediatric to geriatric. But we go beyond that because we offer chronic disease management. So most of us, when we get into our 40s, 50s, 60s, we start having, maybe it's diabetes at first, type 2 diabetes.
Okay.
Maybe I need to lose weight too. And then all of a sudden there's hypertension. Nothing personal, Craig.
Right.
You look great. So what happens is we get people that have more than one issue. And what we find is that downtown, because that's where the clinic is located, we're in the Arts and Redevelopment District. Our patients down there in that community area are usually Hispanic, African American, Filipino. We have the gamut of everybody down there. But culturally, when you look at the different cultures of people, the comfort food is usually not what's best for us. So most doctors say lose weight, eat more salads, eat less fried food, but they don't understand. But that fried food, those plantains, are
easy for them to say.
Yeah, those plantains are what Grandma makes, and they're so good. Sure. Or the beans and rice is what we have with every meal. Or when it comes to our Filipino population, they love Spam, and then fried chicken's my nemesis.
Oh no.
So if you give it to me fried, I'm loving it. So it's one thing for a doctor to say do it. It's another thing for them to put together a culturally sensitive menu for them.
Sure.
Teach them how to cook differently. Teach them how to keep their comfort food but healthier. We do that. We take it to the next level. We teach people how to be healthy, how to be multi-generational, because the kids may be overweight, but then for a fact the parents are also overweight, and then the grandparents are overweight.
Sure.
So everybody has to work at it together.
We literally follow with I have my two kids.
Mm-hmm.
It's amazing how often they act like me, and I always wonder why. But I get it. That's exactly what's going on.
So what we do is when we talk to a patient, we're talking to an entire family.
Yeah.
We're talking to an entire unit. And that means we have to have specialists that handle pediatrics all the way up to geriatrics. So how you take care of a 2-week-old child, brand new, and then the mom who's got maybe hormones swinging because she's postpartum, and then you have grandma and grandpa in there.
Because of the 2-year-old or 2-week-old.
2-week-old baby, yes, because of the 2-week-old baby.
Yep.
If you understand that this is normal, a natural course of what happens in your life cycle, it makes it a lot easier. You don't feel so different. You don't feel so isolated out there. So we have providers at our clinic that handle everything from pediatric to geriatric.
Is this a healthcare service for women, men, children, or is it for everybody? It sounds like it's for everybody.
It's for everybody.
Right.
We have men's fitness exams. We have women's access to healthcare exams. You can be insured or uninsured. We have services and resources for everybody to make sure that they get the services they need to be healthy.
Right. What type of procedures are you offering at your clinic?
We do You can get stitches. We'll do urgent care needs.
That's
Bumps and bruises on children are
Yep.
a natural course of growing up. Who hasn't had a stitch or had to have a brace on their arm or leg?
Did you see the playgrounds we played in back then?
Yeah, we had no safety nets.
No, I know.
We were able to hang upside down.
No cork on the ground. It was
No.
it was the ground.
It was the
You
ground.
hit the ground, yeah.
We actually
No
knew
cushion.
what dirt was. We
Yes.
touched dirt.
And ate it.
And ate it, yes. So all those things that are completely natural growing up that happen to kids, for us, that's every day.
Sure.
We also have an infusion suite there. So we just had a little girl in yesterday, 8 years old, who had the flu, got dehydrated. Instead of
yes.
mom and dad bringing her to an emergency room and incurring that big cost, she brought her in. We got her hydrated. We turned on a little movie, you know,
Nice.
so she got to
Comfort,
watch
yeah.
a Disney movie. She got to be hydrated, and the parents got that comfort that there's somebody out there that's willing to do that for them. We also take care of all any employment exams.
Okay.
Standard physicals for kids. So if they need physicals like for daycare, or if they need physicals for work, if they need a DOT physical to be a taxi cab driver, we provide those services right there. So mom, dad, the kids, grandma, grandpa, everybody can be serviced in the same organization.
Can we all come at the same time?
Yes. We actually have really big oversized exam rooms
Okay.
specifically because we know that when a family comes in,
Yeah.
it's usually mom, dad, and the kids.
Yeah.
You know, and
Grandma, grandpa.
grandpa.
Right, the whole family.
Yeah, we've literally had 9 people in one exam room.
This is unlike anything I've ever heard of.
It's designed on a patient-centered medical home model.
Right.
And it's designed for the downtown community, but we service people all over the state or all over the city. The idea of a patient-centered medical home is that we take care of the needs in our community, specifically down there. So we speak 7 different languages. We are sensitive to the gay, lesbian, bi, transgender questioning population. We deal with what the lifestyle choices or bad choices that some people make downtown are. Smoking cessation's a big program of ours. Eating healthy.
Smoking, you'll help people wing off
We
smoking?
help people stop smoking. We help people educate themselves on lifestyle eating choices. We work with people on not being able to get a lot of exercise.
Sure.
I mean, I could spout out all kinds of statistics. It's wild. Downtown Las Vegas lights up in the state of Nevada as one of the most needed populations of service and healthcare in the entire state.
Just the downtown.
Just the downtown area. We're densely packed.
I was going to say, population.
85,000 people live in downtown Las Vegas. That's 89101 and 104 zip codes.
Wow.
That's a lot of
How?
people.
85,000.
85,000.
Oh,
And we
they
have
go up. They live up in high rises, so sure.
Well, or they live multiple generations to a
Right.
single home. We're only 2 blocks from the Mexican consulate. We're literally across the street from Veterans Village. We work with the vets. We actually have a program with Veterans Village to where when they get people off the streets that are homeless, we actually will go over to the Veterans Village area, our providers, and we indoctrinate them into a 4-wall environment again.
All right.
So we do a behavioral study. We make sure that they get the meds they need. We make sure that they have that they're all cleaned up and that their health is in order, and we chart them. And then because we're across the street, usually it only takes a couple of visits, and then they'll start wandering over to the clinic on their own.
Very nice. You know, if you have questions for Tina, please give her a call at 702-380-8118. And you'll take their call?
Absolutely.
Okay. And that's 702-380-8118. If you'd like to visit this clinic, it's at 1200 South 4th Street, Suite 111, Suite 111. Mm-hmm. Can I talk to you about vaccination? You know, a lot of talk's been going on, not just in radio, but in TV and in print, about this subject. And whether it's good or bad or indifferent, it's something I grew up with. So it prevented me from getting probably a lot of diseases that I could have probably come across. And you hear a lot of people talking today about, you know, the results or what's happening. And there's really no good study out there, whether it's good or bad for you. It's just a matter of doing it and protecting everything, right?
They've tried to link certain diseases to vaccinations, but here's the reality of the situation for people that live in Las Vegas. It's the law. Your child will not be allowed to enter kindergarten without being completely vaccinated. Nevada is one of the few states that has this mandate. And so often we see people that move here from other states and they try to enroll their children and they're not vaccinated. And these poor kids, they come in and they have to get like 10 different shots to be caught up to date in order to even attend schools here in Las Vegas or in Reno. You know, I mean, it just is what it is. I know there's exceptions, there's few, but it's not the norm.
Mom and Dad, before you move here, check things out.
Vaccinate those children.
Yeah.
Nothing hurts me more than hearing all those tears and,
right.
because their little arms are
over
being
time,
stuck.
It's okay. We get that. But all in one shot, no puns there. But
Exactly.
Wow.
So we are a vaccination for children clinic. No child will be turned away for vaccinations.
Great.
You don't have to pay for the vaccination. The vaccination is covered by the state or your insurance. So there's really no excuse not to vaccinate your children.
What if I don't have insurance?
If you don't have insurance, we actually have a program that allows us to vaccinate your child on the state's behalf.
Okay.
And you don't have to pay.
So there are
for
programs out there for people.
Absolutely, 100%.
And I think that's
you don't have to be
first-person care
documented.
clinics. Right. Oh, that's a new one.
You don't have to be documented to have your child vaccinated.
Okay. So you're not asking for a lot. You're just asking for everyone to be up to date.
Yes.
And vaccinated.
Up to date, vaccinated. We'll answer any questions. We'll work with and try to make it as pleasant an experience as possible. We invest heavily into stickers. So all the superhero stickers and princess stickers. We try to make it as feasible.
They pick from the chest out front, right? The treasure chest. Yeah. That's right. As a kid growing up, didn't matter how it was painful going in, but it was always fun coming out because I got to pick from the treasure chest.
Exactly. So we do, and the vaccinations are a big program. We're actually one of the larger providers in our area, and there are other clinics that do it as well. But nobody should go without vaccination for fear that they don't have the financial means to take care of it.
So for an uninsured or non-insured, could I come to your clinic and still be seen?
Yes, we have an income-based sliding fee scale. So if you're uninsured, or you, for whatever reason, you don't have insurance, we get pay stubs or we look at what your income is. And this is by federal guidelines.
Yep.
So the federal guidelines say that people below 200% poverty level get a discount on their services. And that's our choice because we are a federally qualified healthcare center lookalike model.
Okay.
So we actually work under those guidelines. So your scale will slide from $100 all the way down to $40, and we do have rates below that, and we do allow payment plans.
Okay.
So
you're very flexible.
We are very flexible. We don't want to hinder anybody from access to health care.
So I have insurance. Will you accept my insurance?
We accept most insurances. There's a couple HMOs we don't accept, but most insurances we do. We're a culinary provider, Medicare, Medicaid, and private insurances.
And if you have a question about getting into first-person care clinics, call 702-380-8118. So, Tina, what does your patient population look like?
Our population spans income levels, education backgrounds, and ethnicities. On any given day, you'll hear 3 or 4 different languages being spoken in the waiting room.
And how many languages are spoken at your clinic?
We have 7 different languages we speak.
That's great.
So we try to hit the big ones. And we also can, because Nevada is the largest growing Asian population in the country, we are connected with the Asian Resource Center. So if a patient calls and they speak a language that we don't speak, or maybe it's a remote dialect, we can actually have somebody come in. We'll schedule the translator to come in with the patient so that they can hear their health needs and they can talk about their health in their native language.
Wow. That's going an extra step.
We try to make sure the patient feels comfortable.
You do all this. How do you manage such diversity in your group?
One of the things we do is we set our guidelines are set very high, and it's across the board. Everybody's treated with respect. We expect the patients to treat us with respect. So it's one big love fest. And as long as we keep our standards high, we don't dip and dive for different diversities or populations or income levels, and we approach each patient the same.
Right.
We don't have a difficult time with that.
A lot of times you hear about the mistreatment and you hear about all about it and never about the right treatment.
Oh, you don't want to see me go mama bear either way.
Right?
Yes. I've scolded patients. I've said, listen, you know, I understand you're not feeling well, but this is our staff and they're here to take care of you, so you will respect them.
Yep.
And
so you talk to the doctors on a day-to-day basis?
Every single day.
The nurses?
Intake,
everybody?
outcome, everybody. Plus, my office is strategically located to where I can hear a pin drop anywhere in that place.
Right.
So if a patient's not happy, I'm usually addressing that patient's needs before they come to me and ask me to come out.
So why isn't there more of these places out there?
Well, for one thing, we're a 501c3 nonprofit medical clinic.
Okay.
So as a nonprofit, we don't have an owner. We have a board.
Yep.
So one of the things we have to look at is building community board relations. And it's not that easy. It's not that easy to pull people in and have them really have the same passion you have. So I have a soapbox, and I get out there and I run around, and that's basically my job, is creating those relationships and creating that support in the community. It's not as easy as it sounds.
One vision.
Yeah.
You know, and that's what it's all tied up to, right? I mean, you have that, it's your vision.
It's my vision.
And you've made it the way it is. How long you been in practice now?
It'll be 2 years, April 22nd.
Wow.
Yeah.
There's a reason for this, and I think if people just went down and when I walked in, I couldn't believe the capacity. You know, you from the outside looking in, it doesn't look that big.
It doesn't look that pretty either.
No, but you're right.
But once you walk in the door,
it was how we were treated from the moment we walked in the door to the time we went back and got the tour. I was very impressed. So impressed that I'm new. I just moved here 6 months ago, and we don't have a primary care yet or anything like that. So
come on down.
I think more and more people, especially as you said, the influx of people downtown, should really take advantage of this clinic.
Should.
Yeah, and can.
Yes.
As long as they know about it.
And that's the truth. We are a diversion, an ER diversion clinic for UMC, Sunrise, and North Vista hospitals. So when people utilize their emergency rooms as primary care, those hospitals will usually end up saying, hey, psst, go to this clinic.
Right.
They'll take care of you. You don't need to come into the emergency room.
It's not life and death with you.
And we're also set up with them to where the hospitals will discharge directly to the clinic for follow-on exams.
Oh, right
so
on.
we help that the patients don't get readmitted into the hospitals because they weren't taken care of properly once they were discharged. So we try to work with the big guys in the community. When LEAD closed, we got a substantial amount of patients. We grew quite rapidly after LEAD closed because the need downtown and people using the UMC facilities for their primary care service.
How did that impact your practice?
I doubled. I went from about 1,800 patients to 6,500. I guess that's more than doubling. So we grew quite a bit, and we're still growing. Every day we get probably 5 new patients a day, plus our standard patients. So
wow.
there's
so they are finding out about you.
They are.
That's good. Yeah, that's really good. Again, it's First Person's Care Clinics. I'm with Tina, and if you had a question for her, or I'd say go check this place out, especially if you're looking for a new place of healthcare. 1200 South 4th Street. Again, that number 702-380-8118.
I want to emphasize that our quality care measures and standards are the highest that the government asks of providers. So we meet the Affordable Care Act standards, meaningful use standards, patient-centered medical home standards. We're transparent with our findings and our diagnoses. We research and we pull this all together. So we're one of the few. There's a few others in town that actually take that level of care and make it so that the patient can succeed at it. We have educational classes.
You help navigate.
We do.
Wow.
We have care coordinators that all they do is make sure the person gets to those referral appointments, has the transportation they need. If there's linguistic or reading issues, that they help them fill out forms and put things in order so that the patient succeeds. We have a complete safety net designed just for the patient to succeed.
Tina, I want to talk about First Person Care Clinics and about a non-narcotic prescribing clinic. Is that what you are and who you are?
We are a non-narcotic prescribing clinic.
And what does that mean?
Well, let me throw a statistic at you.
Yeah, please.
There are more narcotic prescriptions written in the state of Nevada than there are people who live in the state of Nevada. There is abundance of people who are masking their pain with drugs. And the bad part is that if you get into a car accident or you come out of a surgery and you need to have those pain pills for a short period of time, and that short period of time turns into a longer period of time because the actual real reason why you're in pain, slip disc or something like that, I mean, just
there's a
as
problem.
an excuse.
Yep.
There's a problem why you have pain. Ends up turning into an addiction.
Yeah, now we just exacerbated another problem.
Exactly.
Yeah, crazy. Wow.
So we are a homeopathic style clinic.
Perfect.
Our medical director is a DO and is a doctor of osteopath. We're body manipulations. We work with your body to allow your body to succeed and to not have pain. We'll provide you with equipment and services that will try to alleviate your pain without you taking narcotics. Now, I understand there are times where narcotic prescriptions are needed, but not for prolonged lengths of time where an addiction can occur. So the population we deal with downtown is we have a lot of people who are masking.
Wow.
We have diabetic neuropathy patients who have been on various narcotics for their pain for years instead of actually addressing the nerve issues.
So now we're coming into a physical problem. Now we're coming into drug addiction.
Exactly.
And the doctors or themselves who are prescribing this have literally put the patient at risk.
It's one of those where they don't want to, but they end up. And, I wouldn't say any doctor goes into prescribing saying that they're going to be addicted, but
correct.
You also don't know how the patients are going to absorb. Some people can take a narcotic and not be addicted at all, and it doesn't affect them at all. Other people will absorb that narcotic into their system completely different, and it will cause an addiction very quickly. So one of the things we're learning is that everybody's DNA is made up a different way and how people absorbed the drugs.
Does it have to do with the personality? Do you find that out? Type A, type E personalities that are coming in that are...
No, it's actually not that easy. I'll try to explain it in layman's terms as simple as possible.
Okay.
We have 5 main receptors of how we accept drugs into our body. So for an example, most of us have gone through this where a doctor will prescribe a drug and it's not really working well, or we may have side effects from it, and then they switch it and they prescribe a different drug. Well, 9 times out of 10, the different drug they prescribed has a different absorption rate or a different way that it's absorbed into your body than the other drug.
It has a whole different makeup.
It has a whole different makeup. So your body may not be taking one drug, or they rapidly metabolize it to where something that would send me for a loop, it doesn't affect you at all, especially with our older patients who have multiple comorbidities, patients who are on multiple drugs. We actually do a swabbing for them for DNA to make sure that what we're prescribing them is being absorbed and that the drugs aren't conflicting with each other. So we do a whole med management program, and part of that is keeping them away from narcotics.
And you do all of this at the First Person Care Clinics at 1200 South 4th Street, Suite 111?
That's us.
Wow, you do a lot there.
We do, and then when we're tired of working in the clinic, we go out and do community outreach.
That's beautiful. I love to hear
So
that.
we're out doing the Homeless Coalition, Care Coalition. We're out at doing health fairs. We go to elementary schools and middle schools, and we try to get out there in the community.
So if you're looking for health care and needing to find a place, I would recommend First Person Care Clinics. Would you recommend it?
I would absolutely recommend it. I am a little offended when my friends don't go there.
Right?
It's because we provide the best care.
Right. No, yes. I mean, folks, if you take a moment and go downtown and check this place over and talk to Tina and talk to the folks inside.
We have a phenomenal staff.
Phenomenal staff. It's heartwarming.
Now, if I had to say, like, my number one thing,
yes,
I actually have timers outside the exam rooms, so that if that patient's sitting in that exam room for more than 10 minutes without being taken care of, the timer goes off. Because I don't like it. My time's valuable.
Wow.
I'm going to assume everybody else's time is valuable.
So you're going to have a big, long line at First Care Clinics. Let's talk about your office hours, because they're very unique. Monday,
Wednesday, Thursday, Friday, 8 a.m. to 5 p.m.
Okay.
Tuesdays, we have extended hours from noon to 8 p.m. And on Saturdays, we're open 9 a.m. to noon.
Closed on Sundays.
And we actually let everybody go home on Sunday.
Yeah, no. Hey, after your work week, everyone needs a little respite. Absolutely. Tina, thank you for coming in today.
Thank you.
Greatly. Please, again, if you want to get a hold of Tina at First Person Care Clinics, that number again is 702-380-8118. 1200 South 4th Street. I always recommend stopping in and saying hello. And so now you know a little bit more about first-person care clinics. And I thank you for coming in. Thank you very much.
Thank you for having me.